As folks are joining, before we get started, if you are a local TV station and need permission to record, if you just want to request the ability to record, I can grant that before we officially get started as well. We'll also have a recording coming out of this today, so we will make sure to send that recording around to everybody so that you also have a copy from our end too. All right. So well, it looks like a few more folks are joining, but as people are getting on, I'll go ahead and let us get started since I know folks have a lot of deadlines to get to. Thanks so much for joining us today. My name is Emma Thomas, and I work with the Committee to Protect Healthcare. I'm going to kick things over to Abigail to introduce herself as well.
Hi there, I'm Abigail Pepper, and we're all here today because more than 4,000 physicians from across the country have signed a letter urging Congress to reject the harmful budget proposal that would gut Medicaid and strip healthcare from millions of Americans across the country. These doctors represent a wide range of specialties and practice settings, and they're united in sounding the alarm on the impending disaster that this bill would be on their patients and communities.
And today you'll be hearing from four of those physicians who have signed on to that letter from Utah, Maine, Louisiana, and North Carolina. And they'll be speaking directly today about what's at stake for their patients and communities if this dangerous legislation moves forward. Before we begin and start hearing a brief set of remarks from each of our physicians, I'd like to just note to everyone that the physicians today are speaking as individuals on their own behalf with the Committee to Protect Healthcare, not necessarily on behalf of any employers. So we ask that however folks refer to themselves today as they're giving those remarks, that's how you please attribute them and any quotes today in your coverage. Without any further ado, I'll go ahead and introduce Dr. Christine Mahoney to kick us off.
Hi there. Thanks, Emma. I'm Dr. Christine Mahoney. I'm a family medicine physician in Brunswick, Maine. I'm deeply concerned about the attempts by the current bill in Congress to slash Medicaid funding and take healthcare away from thousands of Mainers. As a family medicine physician, I care for patients at every stage of life. I like to say from birth to earth. I see firsthand how access to healthcare improves health and saves lives. And for many, many Mainers, Medicaid is that lifeline. It allows working people to see a doctor when they need to, working people who don't have health coverage through their employer and can't afford to buy their own health insurance. It allows people to see a doctor to prevent illness and disease. And as a primary care doc, like my colleagues here, prevention is a key to what we do and how we keep our communities healthy. Thanks to Medicaid, my patients can prevent the onset of acute and chronic illness, as well as identify and manage chronic health conditions like diabetes, depression, asthma, heart disease, cervical, and colon cancers. And when we do this, they can stay healthy, keep working, and care for their families. Medicaid has made it possible for children to get their regular checkups that screen for things like developmental delays, vision and hearing loss, mental health conditions. Catching these conditions early can be the difference between falling behind in school or not. Regular checkups keep kids healthy, learning, and flourishing. Pregnant women can get vital care that they need before, during, and after they give birth so that both mom and baby are healthy and well. I've seen what it's like when folks have coverage through Medicaid, and it actually is a great relief as a provider when I know someone has that coverage because I know they'll be able to access what they need. But I've also seen what happens when they don't have healthcare coverage. When folks don't have healthcare coverage, the reality of daunting high-cost medical bills prevent care. I can't tell you how many patients I have seen with late-stage preventable disease only because they couldn't afford to come in sooner. There's nothing worse as a physician than sitting with a patient who's forced to gamble with their health, declining recommended testing or treatment because of cost. There is nothing worse than knowing that the only barrier between my patient and their health is a dollar sign. For thousands of patients and their families across Maine, how the Senate votes on this dangerous anti-healthcare bill in Congress right now will have a direct impact on their health and their lives. That's why I'm asking our senators on behalf of my patients and their families to protect their constituents' healthcare and reject this dangerous bill. Cuts to Medicaid would strip healthcare away from 115,000 Mainers, and 260,000 more will have reduced coverage and reduced access to care. The stakes in this debate couldn't be higher. In Maine, there are 42 hospitals, including 17 critical access hospitals, which would be at risk because of healthcare cuts. For example, Penn Bay Medical Center in Rockport, 28% of their patients are on Medicaid. And at Waldo County General Hospital, it's 1 in 4. If Medicaid is slashed, these hospitals will likely face skyrocketing uncompensated care and may have to cut services or close doors altogether. If that happens, pregnant women will have to travel farther to deliver their babies, and families facing medical emergencies would lose access to their local ER. We know that in these circumstances, minutes can make the difference between life and death. If this bill passes, communities will lose not just healthcare, but also jobs and economic stability because of local businesses, from diners to print shops, would suffer the loss from lost economic activity. This reckless budget bill will cause suffering for Mainers, endanger health and lives, and cause financial and economic pain for families. For the sake of Maine's future, I urge the Senate, especially my Maine senators, to vote no on Medicaid cuts and protect Maine's healthcare. I now turn it over to my colleague, Dr. Addison Alley in Utah.
Thank you, Dr. Mahoney. I am Dr. Addison Alley. I am an obstetrician, gynecologist, and reproductive endocrinologist in the Salt Lake City area. And as an OBGYN, I provide healthcare for women throughout their lives, before, during, and after pregnancy and beyond. I see every day how critical Medicaid is to the health of my patients and their families. That's why I am deeply concerned about the so-called Big Beautiful Bill, which really for my patients is the Big Dangerous Bill. As a physician, I know for my patients that these proposed slashes to Medicaid will mean more complications, more needless suffering, and more avoidable tragedies. Of the patients I care for, many are women and mothers who work full-time, sometimes at multiple jobs, but who still can't afford private health insurance. Medicaid is often the only way they can get the prenatal, postpartum, preventative, and lifelong care that they need. Thanks to Medicaid, I've been able to catch life-threatening complications early during people's pregnancies. My patients have been able to get mental health support while suffering from postpartum depression because of Medicaid, and women with chronic conditions like high blood pressure or diabetes can safely carry their pregnancies to term and deliver healthy babies. I don't think I can count the number of times where Medicaid has made a difference in my practice. I think of the patient where issues were discovered with her baby early in pregnancy unexpectedly, but then was able to get focused specialized care, including extra monitoring at the end of her pregnancy. A scary diagnosis for her was not worsened by wondering whether or not she could see her doctor, and it permitted her to deliver safely. I think of the patient on Medicaid who started developing high blood pressure in the 3rd trimester, which was just diagnosed during her routine visits. We were able to safely monitor both her and her baby, deliver her before she developed complications such as a stroke or kidney injury, and we're able to prevent negative impacts to her child, including loss of the pregnancy itself. Instead, she went home with a healthy baby because she had access to her routine care. If Congress slashes Medicaid funding, this kind of care disappears for thousands of Utahns. And here's something people don't always realize is that cutting Medicaid doesn't just mean fewer doctor visits, it means more medical crises. Because when people don't have access to health care, they skip or delay care. Women will skip prenatal appointments and miss warning signs. They'll give birth without ever having seen an obstetrician. Postpartum depression will go undiagnosed and untreated. Cancer screening will not be performed. And also the children of these women will suffer as well. We're talking about real people, coworkers, neighbors, loved ones, who will face the consequences of legislation that treats healthcare as optional. If Medicaid is cut, 180,000 Utahns could lose coverage. And nearly 1 in 5 Medicaid enrollees in Utah lives in a rural area where access to care is already limited. Rural hospitals, 5% of which are already at risk of closing, could shut down completely. That's why I'm asking Senators Mike Lee and John Curtis on behalf of my patients and their families to protect their health care and reject this dangerous attack on Medicaid. I'm hoping our senators will do the right thing, protect Medicaid, protect women, protect babies, and protect the communities that rely on this care every day. Thank you for your time. Now I'd like to introduce Dr. Beverly Edwards in North Carolina to share some words. Sorry, Dr. Edwards, I think you might be on mute.
Sorry, my name is Beverly Edwards. I'm a pediatrician in Ahoskie, North Carolina, which is northeastern North Carolina, a very rural area. I've been here for 34 years practicing primary care and pediatrics. I feel like that I couldn't even begin to do my job without Medicaid, and the patients wouldn't be getting the help without it. When we talk about Medicaid, we're not talking about this big amorphous abstract government program. We're talking about our patients and their lives. And from the beginning, newborns all the way through teens, and then we follow them as parents as our kids as well. It's important to have a cohesive, comprehensive, high quality medical care available on the local level, because we do feed into the bigger centers. But if we're not here, I just shudder to think about what's going to happen. And we've lost some smaller hospitals in our system already. So things are at a crunch. It is an overwhelming issue. And I just hope that the government, the Congress will see this as not just unnamed faces and people, but like you said, their neighbors, their friends, their family. It's got to affect somebody that they know. But thank you very much.
Great. Thank you so much, Dr. Edwards. And thank you, everyone, for really giving time today to speak about these really important issues. And for those who have been attending it on the press side of things, for really hearing from physicians all across the country. I do want to open things up to reporter question and answer. But first, I think we need to. Yep, I was going to say, I think first we need to just have Dr. Betty Lowe also give her remarks.
Hi, I'll be brief. So my name is Dr. Betty Lowe, and I've been an internist and a pediatrician working in Louisiana, specifically Metairie and New Orleans over the past 28 years. And as a physician, we all took the Hippocratic Oath. And when we recited the Hippocratic Oath, we agreed or promised to uphold two of four very important ethical principles, of which beneficence and non-maleficence are of utmost importance and relevant in this topic today. So beneficence, meaning that we are doing our utmost to do the best for our patients, promoting their welfare and their well-being. And then non-maleficence, referring to the fact that we should first do no harm. And when we decide, or the government decides to cut the basic access to healthcare via Medicaid for one of three patients or three people in our state, that is potentially devastating, only because as a physician, I can't do my job and I can't protect these patients who can't protect themselves. Providing basic human needs for these patients, which includes the vaccines, which includes just access to vision and dental, and to just basic exams that help us detect early some diseases that are potentially very treatable. However, we're not just treating acute processes, we're treating chronic processes that then spills forward into the healthcare system, both into the hospital system, emergency room, urgent cares, et cetera. So just trying to imagine all these patients, which in our state can total 1.6 million Medicaid recipients, trying to flood the healthcare system with no insurance. The entire financial strain, the implications of that is enormous. and really unthinkable, untenable, and truly unethical and immoral to be treating these patients almost as if they are secondary class citizens. That should not be happening, at least in my state. I'm a very proud Louisianan. I was born and raised here. And I plead to Senator Cassidy and Senator Kennedy to really think about how we can better make Louisiana stronger, healthier. And by cutting Medicaid, I think we're actually cutting our nose to spite our face. We're saving only to have to spend more in the future. So my hope is that government rethinks this Medicaid bill and really prioritizes the health and welfare of the people. It's not about the money, and it should never be about the money. It's about the people and their lives, the human beings, the quality of life that we're trying to preserve. Thank you.
Thanks so much, Dr. Lowe. And for those folks asking about the letter that was mentioned at the start of the call today, that was just shared in the chat for anyone looking for that letter signed by over 4,000 physicians, including the folks that you're hearing from today. I'll now give a moment for folks to let us know if they have questions that they'd like to ask. If you can please put your name and outlet and your question in the chat, that will just help us call on you and make sure we know which state you all are asking questions from so that the physician from your state is able to chime in. While folks are just adding questions into the chat, just also wanted to open it up and see from our physicians, now that you've kind of heard remarks from each other, if there's any kind of closing points that you wanted to make or any kind of reflections from what some of your colleagues have said in other states, if this is kind of similar to the impact that you've been seeing or know you'd be seeing in your states as well.
Yeah, I wanted to go off what Dr. Betty Lowe was saying, that
Dr.
sorry,
Al,
now I was muted. I just wanted to echo what Dr. Lowe was saying, which is that when patients lose financial access to healthcare, they don't stop experiencing healthcare issues. And so it's not that these patients are not going to eventually require our care. They're just going to show up and with more advanced conditions, higher risk, more crises. Some of that will both tax the system, tax the physicians, nurses, staff that will be taking care of them with overall worse outcomes. So access to care is an investment in so many different things. The most important thing is the health of these people, but also it does have a secondary benefit that it does increase the efficiency of the overall system when we can treat things before they become crises.
I think that was very, very well said. And for kind of reporters tuning in and probably following along, it looks like the Senate has called for the voting process to start on this on Friday. So certainly monitoring over the next few days for movement on this legislation. I have one question that I wanted to call up here and read out, and then if anyone else wants to unmute and ask, please feel free as well. I think, one question that reporters are wondering is, why is it, from each of your perspectives, like, why is it important right now for doctors, other healthcare professionals to be speaking up, to be taking a stand on what can be considered a political issue, Congress, taking a vote on this legislation? But in kind of your own capacity, why are you kind of taking the moment to come forward and sort of make this impact known for your patients?
I think in being just an inherent quality for us as physicians, to advocate for our patients. That's what we do every single day. And honestly, you know, the reason some of these patients can actually see us is because of their Medicaid. And, you know, some healthcare systems may not even accept Medicaid, but for those who do, we realize the impact that this insurance allows them and affords them. And these patients are very, very appreciative of it. And I tell them every day that your Medicaid is affording you some of the medicines that even on commercial insurance, some of these patients are not receiving or cannot get. And I said, and it's such an amazing, like, I'm so thrilled. I'm so happy for them myself. And once again, I think, you know, if we had 1.6 million people in Louisiana without this insurance, this particular insurance, we're talking about children, and we're talking about some of the most vulnerable population that are relying on Medicaid in order to help them, to help these patients get the services that they need. And we're talking about some very extensive services, not just as an outpatient, but also in the hospitals. And we're not just talking about children and adults, we're talking about adolescents too. And I have spoken on this before, where we have college-age students who are on Medicaid because they really don't make enough money, honestly, to be able to afford insurance. And these are people that are going to be probably very, very successful later on. It's just that during this transition period of their life, they have that need. And so are we not going to afford these people the chance to have healthcare and to protect their health? Without your health, you have nothing. And I tell patients that all the time. Making ourselves as healthy as possible will allow us to thrive. And it's not just us thriving individually, it's as a society thriving as well. If I am sick and I have to rely on others, then it's definitely going to affect the job force. It's definitely going to affect others and having them to maybe work longer, harder hours because others are sick. They're unable to actually do the work that they would like to do, that they want to do. They just physically may not be able to do it.
Dr.
Adding to
Edwards,
that,
did you want to chime in? Oh, go ahead.
I was just going to say, regarding the question about why do we feel the need to speak up now, I don't think we necessarily see this as a political issue. I think we see it as an issue of humanity, and I don't think anyone out there has the goal of specifically injuring anybody. But the difference is we see these patients every day. So unless you are on one of these insurance programs or you're taking care of patients who are on them, you may not understand the scope of how important they truly are to these patients. And we're just hoping to communicate that to those who can make a difference so that we don't lose this vital lifeline for our patients.
Dr. Edwards?
Hi. Okay, I feel like here in a hospital, I have a pact with my patients and they with me that we're going to be there for each other. And for the past 34 years, it's been that way. And so now I'm seeing the grandchildren, and it's just amazing that we can do that and kids can be covered. If we can just do that, let all the kids be covered. I mean, just think of all the things we could avoid, all the bad things. So, but I'm grateful that we have it here. And we would have nothing. We'd lose our hospital and everything. People would lose their jobs. Businesses would close. Yeah.
I wonder, Dr. Edwards, on that same point, you know, one of the questions someone was asking was kind of the costs analysis of spending the money to have this program versus taking the money away and then paying the consequences when people do get really sick. And I wonder if you maybe speak to that a little bit. It sounds like kind of what you're saying now. If we don't treat children, if we don't do preventative care, that actually could end up costing a lot more in the future.
Absolutely. And the hospital system that services us is where I went to med school, and they're throughout Eastern North Carolina. And that's been their motto from the beginning. It's just like, we're like salt to the earth. We have to help each other and do this together as a community. And so that's how I've found myself here and surviving against a lot of odds, but happy to be here and grateful for my patients too.
And then for kind of other folks on the call too, I think I'll take this last question before we wrap up. If, if Congress as a whole does end up passing this bill and does end up authorizing these massive cuts to Medicaid, in your perspective, what message is that sending to these senators, these congressmen's constituents? What does this mean for, the voters? What kind of message does this send to everybody in your states?
It seems like they don't understand that that's not going to be a good thing. And I don't get it. It's like, is the money so important that you're going to say your life is less worthy than mine? So I'm just like, how can they sleep at night? They're not babies, they're adults making decisions that can hurt other people.
I think they have to realize that investing in the people, investing in the future, the children are our future. And if they are not getting quality care, the care that they need in order to be healthy and to be happy, mentally, physically, emotionally, then how are we expecting the future to be bright, to be strong? It's almost impossibility. So you can save money now, you can pay now or pay more later, and what you're paying for later is actually advanced disease processes and shorter lifespans. I mean, that's what we're going to be looking forward to. It's not going to be a thriving population. It's going to be a very sickly population of people. And I'm not sure that they understand that it's not a political thing for me either. This is very much a human rights issue. I mean, honestly, this is like an issue that I don't know how anybody could sleep at night knowing that so many people will have no access to health care. And when they do seek health care, they're still going to get a bill, even though they don't have insurance. And so the enormous pressures of that, finances on the patient individually, but in the entire system, is just a domino effect of a disaster. I'm not understanding how they cannot see that. Like, it's just unavoidable if you strip away this insurance benefit for these patients. And like I said, so many patients, pediatric patients, and 56% of those who are most vulnerable in our state are relying on this. And we're talking about patients that maybe are in a wheelchair, maybe from meningitis. They were devastated from birth. Their parents can't afford the type of, care that is needed without the Medicaid benefit. And we see this time and time again. And so I just implore our senators to make the right decision for the right reason.
The message it sends to me and a lot of Mainers would be that our senators don't care, that they don't care about them, they don't care about their futures, they don't care about their health and livelihood, they don't care about the healthcare system. They don't care about doctors, nurses, medical assistants, anybody part of the healthcare system. Yeah, it's a deep lack of care for American people.
And I also think that when it comes to what could be more important to invest in than the health of the country, if our belief is that here in the U.S. we can work to improve our circumstances, that we would accept that we would allow a certain segment of the population to be stuck in a perpetual cycle of low income and bad health, especially if we take away their access to the health care. Whereas if we really want to let this country grow and allow everyone to attain their maximum potential, then we invest in the health of this country as a first step, and then everything should follow second to that, I believe. And then secondly, if this measure does pass, it does also kind of demonstrate that I feel like there's a disconnect between Congress listening to the voices of those who have dedicated their lives to the betterment of the health of people. We have all the medical societies calling out in unison, saying, please do not do this. We know it will hurt people. Yet there's been an energy to keep moving forward. And so we just wanted to add our voices to that and say, we know that would be a mistake. It will hurt people, and we have a chance to prevent it.
Thank you all so much. And thank you again to our reporters who were able to tune in today. As we mentioned, we'll send around a recording to those who were on, so your newsrooms can have it. And thank you to our physicians for joining us. If anyone needs kind of spelling of everyone's names, we just put those in the chat and can send them around as well. But thank you so much to everyone for joining us today. Hope you have a good rest of your day.